Hi, welcome. This is Dr. Khanna here, the keratoconus specialist, and I have a wonderful mom and their son, and we'd like to hear their story about how keratoconus can affect young kids.
Hi, my name is Natalie, and this is my son Christian. And the first thing I really just want to tell all the mothers out there is if the teacher in your child's school, whether it's elementary, middle school, give you a referral note to take your child to go get, a vision check to an optometrist, and you take them to the optometrist, and the optometrist says, no, they don't need glasses. And you go to another teacher, another year tells you he needs glasses. You go, the optometrist doesn't tell you no. I feel like if 2 to 3 teachers already told you to take your child to go get their eyes checked, you should maybe consider taking them to a specialist, which is an ophthalmologist, not an optometrist. And that's one of the biggest signs that your child might have keratoconus but needs further, you know,
Specialized investigation.
Yes, investigation of the eye. And that's how we found out about his keratoconus. For so long, elementary teachers would tell me I would take him, he will get cleared, nothing. Baseball coaches would tell me nothing. I would take him, nothing. It wasn't until one day I started working at an ophthalmologist myself, and I took my son to that doctor, got his glasses, and then a year later, he's like, I can't see. And I'm like, what do you mean? We just got the glasses, the goggles, all of that. Spent $1,000 on just buying all of that stuff. And I was like, you're not using them. Finally, he's like, you know what? Mom, really can't see. So I took him back, couldn't find a prescription. And actually, a doctor at Dr. De La Peña's office referred me to Dr. Khanna.
Oh, that's so kind and intelligent of them. Because to diagnose this disease, we use very specialized machines which are very quick, painless, no touch. So even a kid 10 years old, we can diagnose. The sooner we diagnose, the better it is, because intervention earlier preserves the vision. Because this is a disease where the corneal fibers, due to genetic reasons, allergies, and rubbing, move away from each other and are not able to sustain the pressure inside the eye. So they bulge outwards. So doing interventions like cross-linking, which can stiffen the cornea, and CTAK, which brings the shape back, you can go back to being 20/20 and get your driver's license, what he's looking for. So we'll hear from you. You haven't got your license yet, right?
No, not at the moment. I've been kind of holding off on that just due to vision reasons. Just feeling not comfortable with my ability to drive at night. But hopefully after the surgery, my vision will make a drastic leap in improvement, and I'll be able to comfortably drive at night. During the day, it's been fine. Just like I said, especially on the freeway, sometimes it can be hard to read, freeway signs, exits, and things like that. But with the CTAK operation, I've noticed even within the short period of time I've had since the post-operation, just improvement in my vision. And that's just off the initial healing process. As I bet as it continues to heal, and given the proper amount of time for my eye to recover, it's only going to get better. So I am looking forward to doing that, just because honestly there's a lot of children out there who maybe are a little hesitant towards doing it. Maybe they're scared to get operation on your eye. I know your eye is a very sensitive area, and as someone who isn't as informed or educated about it, you kind of feel fearful about and doing anything to jeopardize your vision. Vision's very important. You want to be able to see the world and interact with the world around you. But I would 100% recommend doing it. Honestly, it's honestly just something that's honest. Sorry for lack of a better term, but it's just honestly just life changing. Honestly, I think you should give it a try. It'll just help you whether you're an athlete. It'll help you in your sport. If you want to just pursue any other field of or career, just having better vision in general is just gonna be useful. So I definitely think that you should just go for it.
And the glare he's describing are we termed as higher order aberrations, because the cornea is not smooth in keratoconus, so the light is getting disrupted when it's hitting. Mm-hmm. So CTAX brings it back. Just like giving an example, suppose somebody has a beer belly, the navel points downwards. Mm-hmm. But if you put a nice belt and the navel comes up, that's very much similar. The cone of the cornea gets pushed down, and the light is hitting at an oblique angle.
Okay.
So by adjusting that, the glare, so nighttime you can see one car as it is instead of seeing
Yes.
fuzzy borders, which
Yes.
makes it very dangerous.
Yes, it's been dangerous, getting him on the road and being, I'm a mom and he's driving and oh my God, I was holding on to my dear seat, like with dear life. And I just knew, I was like, you know what? Dr. Khanna told us about the CTAK like in February, March, and we've been thinking about it. We were dwelling on it. We're like, yes, no. And then the night driving came and I was like, that's it. We're going to do the CTAK. Let's call and schedule the appointment. So cross-linking and CTAK. For my Keratoconus kids out there, go ahead and do it. Do not be afraid. And to all the moms, I make sure you get an authorization request from your insurance and try to, figure some type of financial way for you to be able to, have this procedure done with your child, for your
And
child.
you had some advice about rubbing too, right? You guys were telling me.
Oh yes. So as a child, I'll admit that I did rub my eyes a lot. I didn't know at the time that rubbing can be so harmful and detrimental to your vision. But over time, I've learned, especially coming with Dr. Khanna, he's informed me about rubbing and the dangers of, constant rubbing to the eye. It's just something that you want to avoid. Sometimes rubbing can help us see better in the moment, but over a long course of time, long periods, it will be a detriment to your vision.
That's a very good point. What happens when you rub? Accidentally, you push the cornea up.
Yes.
And so you see better for some time, but it
Temporarily,
weakens.
yes.
Same thing, you have to be very careful about hard contact lenses. It's like tying a very tight corset to keep your tummy in. And so you feel very happy, I'm being more fit and I can see. But I just saw a girl, 26 years old.
Yes.
She's a manager of a Pizza Hut. But the hard contact lenses caused the rubbing so much, the cornea scarred, became thinner, and ruptured.
Wow.
So I cannot
those-
help in those cases. So it's better not to wear hard contact lens. Moment the doctor tells you hard contact lens, you say, I'm going to dial 1-800-411-Khanna.
Hey.
And go right there.
Yes,
This is
yes,
very
sir.
important because you see 30 years ago there was no cross-linking, no intacts, no CTAK. People just had to go on disability and later on have corneal transplants.
Yes.
Corneal transplant is a big surgery. So by our interventions, we have been able to prevent corneal transplant and return people to useful vision.
Yes.
But if you let it go and get the false sense of protection by wearing hard contact lens, I can see. We just saw a football player too. I won't disclose who it is.
Yes.
And poor guy had it in both eyes because people depend on specialists.
Yes.
But till this type of education is spread directly to the consumer, they have to rely on the knowledge of the doctors they are going, who might not have the latest knowledge. They might have gone to
Outdated.
school 30 years ago
Yes.
and they're still thinking that it's like that,
Yes.
So the moral of the story is your vision can be improved if you have a thoughtful mother who knows it's better to intervene early than to just think about it and ask this person and that, but go to the source who are the specialists in this disease. And you'll be surprised, this disease is much more common than ever known. When we were in medical school, we didn't have all this equipment to diagnose. And we used to use light and all, and that's why there was corneal transplant. And we thought that incidence was 1 in 2,500. Now we know it's 1 in 200.
Oh wow.
So second important thing is, like, not everybody may need intervention, but out of those 200, none should have LASIK. Because LASIK weakens the cornea and then that can lead to it.
Yes.
So that's why it's very important to go to cornea specialist to, as
Prevent
she said,
problems before
yeah,
they
when
happen.
my mom was saying the vision is changing frequently and, the prescription is not changing.
Yes.
So those are very big telltale signs. A stitch in time saves 9 is a very famous saying. So same way, even as a teenager, if you're noticing, stop rubbing, do not wear hard contact lens, see a cornea specialist, and we are always available to guide you. Thank you.
Thank you so much.